me Dr. Vivek Murthy. He served as the 19th Surgeon General of the United States. As America's doctor, Dr. Murthy created initiatives to tackle our country's most urgent public health issues. As the Vice Admiral of the U.S. Public Health Service Commission Corps, he commanded a uniformed service of 6,600 public health officers globally. During his tenure, Dr. Murthy launched the Turn the Tide campaign, catalyzing a movement among health professionals to address the nation's opioid crisis. He's also issued the first Surgeon General's report on alcohol, drugs, and health, calling for expanded access to prevention and treatment, and for recognizing addiction as a chronic illness, not a character flaw. Thank you so much. This is why we are so honored to have you on tonight, and also to talk about your new book that we're really excited about, called Together, because we know that it is the perfect title for this period of time that we're all living through. Such a unique experience, and Together really tackles those questions and topics of loneliness that so many people are feeling right now in this isolation. And maybe some of us are a little bit too together with our family, and that's an issue too. But I mentioned to you earlier, I had a little bit of alone time myself last night because my kids slept outside in a tent with Patrick. And so I was inside with baby Marshall, who went to bed early, and I could watch whatever I wanted on TV. It was like a nice little break. But how are you doing?
Well, that sounds incredible. And I totally can't relate because we have two small kids who are 3 and 2. And we haven't come up with the ingenious idea of having them outside in a tent with one parent yet. But maybe we'll try that.
No.
But we're doing okay.
It was freezing. It was so cold.
Oh, no. Yeah. Well, we're in Miami, so it's a little bit more temperate, so maybe they can manage it. But we're doing okay. You know, my wife and I are with extended family. We're trying to, like everyone, just make sense of the chaos and figure out how to take care of the kids and work. But you know, thankfully we're healthy, and you know, in a moment like this, that's really the most important thing. So
I agree. Could we maybe start with just the conversation about what we're all living through right now, which is COVID-19, and your thoughts about why it's so important for us to continue this, you know, stay-at-home order that we've been under, and with conversations about reopening, maybe what that could look like for us going forward, and how we protect the people who are most vulnerable.
Yes. Well, I think that this is a moment I think we're going to remember for the rest of our lives. We have not seen a pandemic like this in over 100 years. And it's really forced us to turn our lives upside down. And, you know, first, I want to thank people who are making the extraordinary sacrifice to observe these stay-at-home orders and to be responsible in terms of public health, even though for many people it's coming at tremendous cost, economically, psychologically. I know it's not easy, but because of the sacrifices that people are making, we were able to see a dramatic reduction in what would have been an incredibly high peak of infections and deaths in New York City, as well as in the broader state and in other states across the country. So the first thing I just want to say is thank you to the public, because the most important tool that we have right now, because we don't have a vaccine and we don't have a medicine, are these behavioral changes. So what you do really does make a difference. Yeah. The second thing is, how long is this going to go on? And the bigger question of when can we just get back to pre-pandemic life, and that really depends on how quickly we can get a vaccine. And what we've heard from Dr. Fauci, you know, at the, you know, who works at the NIH, and what we've heard from other government scientists, is that it'll probably take us at least a year to get a vaccine. There's some hope that if everything goes right and all the stars align, that maybe by January there might be a vaccine, but I don't think we should plan on that. I think we should hope for that, but not plan on it. I think we should assume it could be later in the year, 2021, that we end up finding a vaccine. But that doesn't mean that we're going to remain under lockdown until then. What we can do is we can slowly start to open up when we have a few key things in hand. Number one, when we see the number of new cases significantly drop And number two, when we have adequate testing so that we have the ability to identify infection where it might crop up again in the community. And third, we've got to be able to contact trace and quarantine people. If we find an infection, but we're not able to figure out who else is at risk and make sure we limit their exposure, then that one person who's infected is like a spark that we're throwing on a bale of hay, right? And that fire could spread rapidly unless we contain it. That's why both testing and contact tracing are both so important. And finally, we need to make sure we've got adequate surge capacity in our hospital systems. We saw New York get really overwhelmed by the number of infections, and it could have been a lot worse if people hadn't stayed at home. We've got to make sure that come the fall, when we could experience another surge of COVID infections, we've got to make sure that we're prepared this time and that we can support our nurses and our doctors and our other hospital workers. We've got to make sure we have enough protective equipment also for the non-healthcare workers who are on the front lines, the men and women who are working in our grocery stores, who are postal workers, our law enforcement officers, and other first responders. So if we have these pieces in place, we can start to open up cautiously. And it won't be like flipping a switch, but we'll be able to start going back out while keeping social distance, while ensuring that we're wearing masks, while limiting our gathering in crowds and making sure we're getting together in groups of 10 or less. And also while taking extra precaution with the vulnerable, people who are older and those who have chronic medical conditions like diabetes and hypertension and obesity.
Mm-hmm. You know, it was funny. I was talking to my mom, and my mom is such a social, person, and this obviously is so difficult for all of us, but somebody who's really active particularly. And we talked about what we're really missing. And for me, it wasn't obviously being able to go out to the stores. It wasn't the mall reopening. It's the small group get-togethers, which I reminded my mom that those seem to be almost just as dangerous as going out where we know we'll wear a mask or we might wear gloves, but when she does her book club, the impulse would be to be more relaxed and not to have those things and to sit in your living room with friends, although you might not know if they're carrying something. So how do we move towards reopening and relax some of those things, knowing that in public places we'll remember to do that 6 feet, and we'll remember to wear the mask, and we'll try to remain vigilant, but that we may start to let down our guard when we're in more intimate settings, but still with people that aren't part of our household.
Yeah, so that is really tricky. And part of this becomes a question of how much risk are you willing to take? Recognizing that there is both a question of individual risk, thinking about ourselves and our families. Do we have somebody who's elderly at home that we may not want to expose? Do we have a child who may have a medical condition who we want to protect? If those are the case, then we may want to be extra cautious, even with small groups of friends, and either not get together in small groups or get together with cautions, so with wearing masks and with keeping distance. On the other hand, people who are younger and who are healthier may find over time that they want to take a little bit more risk, or at least be less cautious. They want to venture out a little bit more. They want to go to the grocery store, and they want to see a small group of friends who are also low risk without perhaps a mask on, while keeping 6 feet apart. And we all have to scale our risk here. But what we have to think about also is that we have a collective responsibility to society that's even more important now than ever before, because it's really clear in moments like this that one person's health really does affect another person's health. We've known this more broadly when it comes to health, that if one section of our community is ill, that does affect all of us. But pandemics really make that even more clear. And if somebody, for example, takes a lot more risks than they should, and they get sick, and we know that up to half of people who have COVID-19 infection don't have symptoms or have really mild symptoms, they could quickly spread it to a whole number of people, and it could become a new outbreak in our community. And that's why this isn't a simple question of individual liberties and everyone just do their own thing and protect themselves, because your health matters to my health. My health affects your elderly parents' health. we're all deeply interconnected in this moment, and this pandemic is making that clear.
I think it really speaks to our broader healthcare system and the improvements that need to be made there as well. And we're looking at this and how interconnected we really are, and knowing that if one person among us is vulnerable, we're all more vulnerable. So thank you for that. I can't help but think during this time too about the teenagers, the kids who are missing out on their senior year, and how vulnerable they may be emotionally at this time, and what kind of things we need to be thinking about, who we should be thinking about, not just for the vulnerable populations for the virus, but who might be vulnerable for the mental health and substance use issues that we are going to anticipate coming out of this.
Yeah, I'm really glad you asked, Amy, because it feels like in moments like this that we are most focused on the physical health impacts of the pandemic and on the economic impact. And these are both incredibly important, and we've got to focus on them. We've got to help people who are struggling. But we also can't forget that there are other impacts that are hidden beneath the surface that we can't see as easily. And one of those is the impact on our mental health. And what we know from looking at hurricanes and tornadoes and other natural disasters is that there's often a spike in mental health issues that accompanies these major disasters. And it doesn't end when the last house is rebuilt or the last piece of debris is cleared. It often continues for weeks, months, and sometimes even years afterward. Because we have to think of these moments of extraordinary upheaval as moments of trauma that we're experiencing individually and collectively. And that trauma leaves a mark. How deep a mark it leaves on an individual is a complex product of their genetics, their prior life experience, the social support they have around them. And so we can't always know ahead of time who's going to be most impacted, but we can readily predict that experiences like this will lead to increased levels of depression and anxiety, that it can lead to greater instances of suicide and loneliness. And so we've got to be prepared to handle those challenges as a healthcare system, as institutions, as schools and workplaces, and also as individuals and family members and friends who, even more than usual, need to look out for each other and check in on each other to make sure we're okay.
Yeah, thank you. I'm thinking too about how this is layered now on top of a crisis that already existed, the opioid crisis, the deaths of despair that we've seen in this country. And now to bring this on top of it and know that people have been disconnected from their recovery communities, that they aren't having the interaction that they had before that. How looming of an issue do you feel like this is coming out of COVID?
Well, I think you're absolutely right. I mean, we had a deep struggle with substance use disorders long before COVID showed up. And I do think that we're at high risk of that worsening because of COVID. Because what we have to think about these moments of trauma as is we have to think about them as just major stressors to our system. Right. And stress, the more we learn about stress, the more we realize that it just impacts our bodies and our minds in just such profound ways, and often insidious ways that can be invisible in the moment. But that stress can threaten people who have been living in recovery and can threaten to relapse in their lives. We also know people who struggle with depression and anxiety, that in moments of stress, they can also experience a worsening of their mental health. And people who have no prior diagnosis of mental illness can experience new episodes in the setting of extreme stress. Keep in mind that what's unusual about this particular stressor is we don't know what the end date is. Mm-hmm. And the uncertainty around it creates an even deeper layer of stress, which is really tough to contend with. And you can see it just manifesting even in our own lives. Like, often when we think about stress, we think about the stereotypical image of somebody who's, just sitting in the middle of, in the middle of the floor and just, tearing their hair out, or who's crying because they just can't deal with the situation. That's not always what stress looks like. Extreme stress can look like increased irritability and anger It can look like somebody who's losing their temper more with their family or with their loved ones. It can look like somebody who's withdrawing more and not returning phone calls and not showing up, at family events. It can look like somebody who's experiencing just a decrease in their mood and is experiencing sometimes suicidal ideations and feelings of depression. Stress can look like different things, and it can also have physical manifestations. It can often show up in our lives as physical pain. And if we have chronic pain, it can make that pain worse. Mm-hmm. And so I have a great deal of respect for stress. We, I think as a society, tend to poo-poo stress and say, that's something we should be able to suck up and deal with like on our own. But the reality is that while we each need to build tools in our life that help us deal with stress, whether those are moments of solitude or meditation or prayer or time we spend in nature, it's also incredibly clear that one of the most important buffers we have against stress are our relationships. And that's why so many of us will reach out to a friend when we're having a crisis, because there's just something about knowing that there's somebody who gets us and sees us and can support us that just reduces that stress down a level. Moments like this make it all the more clear that our relationships are more important than ever before. If you're like me and you've always prioritized people in terms of your values, but you've often fallen short in terms of prioritizing them, in terms of where you put your time and your attention, your energy, then this is an opportunity for people like us to try to close that gap and to make sure that our lived values are, the same as our stated values. So that's one of the things I'm trying to focus on during this time.
I don't know that to be true about you. You are always available. You're pretty good, just as a friend and a person that we've known for a while. You've just been always able to connect and be present. And I know that's one of the things you talk about in your book together, about being able to really be in the moment with someone for an extended period of time, not hours, but how long should we really make sure that we're socially interacting? What do we need as human beings for that period of interaction, for it to really kind of fill our souls?
Well, that's a good question, Amy. And, one of the things, I learned this process of writing this book on social connection and loneliness took me probably the better part of 2 years. And I'll be honest, it was a very painful process because I'm an exceedingly slow writer and it's my very first book. So I was on this very steep learning curve. But I felt like incredibly privileged to learn from all these people around the world who had been thinking about how to strengthen social connection in their life. And were asking these exact questions. How much time do I need to spend? What do I need to be doing during that time? What's the best way to build a connected life? And what I found that was really interesting is that you don't actually need to spend a massive amount of time with people to feel deeply connected to them. A small amount of time can go a long way if you focus on the quality.
Depends who it is, right?
Yeah, so I found, for example, one of the things I came to realize is that even if we spend 15 minutes a day with somebody that we love, and that could be video conferencing with them or calling them on the phone or writing to them to ask them how they're doing, that can make a really big impact on how we feel. And if we focus really on the quality of time that we have with people, if we focus on quality by eliminating distraction when we're talking to somebody else, that can really boost the satisfaction that both people get from the interaction. Look, the truth is a lot of us, myself included, have had the experience of calling a friend on the phone, but then also checking our Instagram feed, refreshing our inbox, Googling a question that popped into our head, watching the news in the background, and we convince ourselves we can multitask, even though the science is very clear that as human beings, we cannot. Mm-hmm. And so I have found, though, that just 5 minutes of deep listening, of open sharing, of being fully present can often be more powerful than 30 minutes of distracted conversation with someone else. And this is our chance to refocus on that quantity of time, on the quality of time, and also on one last piece that I found to be incredibly important as well, which is service. And it turns out one of the most powerful antidotes to loneliness is service. And there's a reason why this is the case. That has to do with our biology. It's because when we are chronically lonely, one of the counterintuitive things that happens to us is our threat level rises. we feel less safe, so our focus turns increasingly inward. And we experience an erosion of self-esteem over time as we start to believe that we're lonely because something's wrong with us or because we're not likable. And that makes it harder and harder to reach out to people and to interact with them. It makes it more difficult to show up and to authentically be ourselves because we worry that maybe we're not enough. Maybe we need to try to be somebody else to be appealing to the other person. Service is powerful because it breaks those patterns. What it does is it shifts the focus from ourselves to somebody else in the context of a positive interaction. But it also reaffirms for us that we have value to bring to the world. And that can be extraordinarily powerful. And in the age of COVID-19, service doesn't have to be going to a food bank to volunteer or building a home for Habitat for Humanity. It can be checking on a neighbor who's older and may not feel comfortable going to the grocery store to get food. It could be having food delivered to a good friend who might be struggling to homeschool their children and telework at the same time. It could even be offering to virtually babysit, even just for 15 minutes. If you can occupy a parent's child for 15 minutes on the phone, I guarantee you they will love you for it. Because that 15 minutes to just sit down and breathe is invaluable. So there are many ways to serve if we're willing to look for it right now.
Yeah. Oh, I so appreciate that for sure. Virtual babysitting. We have a Alexa show that we can just drop in on my mom's kitchen because she has one too. So we can just pop in and she'll work in her kitchen. And then suddenly she hears all the kids screaming her name and she has to come over and she'll read to them through the Alexa. And it's great because they can do it themselves. It's not something on the computer that I have to set up a link. And it's so helpful to have that interaction and connect. And, I think it's so true, as you said, that there's so many times when we are trying to connect, but we don't realize just how distracted we are. I've noticed even with the Zoom calls, we have on my husband's side of the family, we do a prayer on every week with the family, and we spend an hour together. And we've sat down, and it's something we've just started doing since the virus. And we sit down, and I feel very much like I've been able to focus more in that time than when, sometimes even than when we're all together, because I've set aside this hour to be looking. I know what we're there for. And in the past, we just didn't always remember to reach out and make that call or connect with people. But we've really, during this time, made sure that we're doing it. You're seeing everything. You're talking to lots of folks about your book and about this work and about loneliness, which we know even in other countries, they've set up a minister of loneliness and other things like that. What do you see that you're excited about or that you feel hopeful about? Because I imagine we will make some advances and have some positive outcomes that we can take from this. Is there anything that you're seeing right now that you can feel like we're moving in the right direction?
Well, there, as challenging as times are, I think there's a lot of good that I'm seeing. I think, on a broad level, I've just seen individuals and companies step up to help fill the gap in terms of producing protective equipment that hospital workers and others need. It was so heartbreaking to me that so many of my friends and colleagues, and even my own father and sister, were having to see patients without the masks and other protective equipment they needed because they just didn't have any. They're putting their lives at risk in the process. But it was extraordinary to see people just step up and not just produce them in their factories, but also to see people sewing masks in their home and then dropping them off at hospitals. It's also been amazing to see the human response in terms of how we're taking care of each other. I've seen people with signs, up in their yards, thanking for those on the front line for doing their work. I've seen people in our neighborhoods, even here in Miami, Florida, where I am at the moment, dropping food off at the homes of people who are healthcare workers because they know that their families are worried about them and they're taking extra risks so the rest of us can be safe. I've also seen a number of parents just step up and put together lesson plans and share them with other parents because they know, man, that the homeschooling is not easy. If there was ever a time when when we need to sort of step up and see how much we should be appreciating teachers, it's right now. Because I think a lot of us who are trying to do the jobs that our extraordinary teachers do every day know that it's a lot harder than it looks, and it should be supported a lot more than it is. So seeing a lot of that has been amazing. And I got to say also, I help a number of organizations, including nonprofit organizations and some companies, just to figure out how to respond to this epidemic. And I've been really impressed at how so many organizations are really stepping up to take care of their people. Not everyone is, and not everyone necessarily has the resources to be able to do so as well as they should be. But so many of them are, and they're looking out for the mental health of their employees. They're making guarantees they're not going to lay people off for at least the next 3 months. I mean, people are really trying to do their best in really difficult circumstances. So that has all been really extraordinary to see. And when I think about all of that, Amy, there's what it reminds me of is, despite how cynical we may feel we've become at times as a society, despite how it can feel like everyone is really out for themselves in the culture that we've built, the reality is that when the chips are down, we return to who we really are, which is a race of people, a species that is really there for each other, that steps up to look out for each other. One of my favorite stories, which I tell in the book, is a little known story about 9/11, but it's about the 9/11 boat lift. And are you familiar, Amy, with the 9/11 boat lift? Has that crossed your path? Yeah. So most people don't know about this, but on that tragic day in 2001, when the Twin Towers were hit and when the flames were building and the smoke was growing, people were fleeing this site, but they didn't know what direction to go in. It wasn't easy to tell which way was north. And so many people inadvertently ended up fleeing south. And they very quickly encountered the waters of the Hudson River, which offered them no path to safety. And the minutes ticked by, and as it grew higher and higher, thousands of people, started to build on the southernmost tip of Manhattan. And they became increasingly desperate and worried because they knew there was nowhere to go. Now, the Coast Guard recognized that there was a crisis building, and they didn't have enough boats at that moment to rescue everyone. So they did something that they had never done before, which is they issued a call for a civilian boat rescue and asked every boat in the area to come help rescue people. Now, in that moment, think about this. You have this unreal crisis that has just, a terrorist attack that has just unfolded. You can see the flames. You can see the building collapse. Are you going to run toward that fire, or are you going to run away from it?
Right.
Well, what happened is when the chips were down, scores and scores of boats were seen streaking toward the southern tip of Manhattan within minutes. And these boats brought passengers on board. They gave them water. They ferried them to safety. And within several hours, they rescued nearly 500,000 people.
Wow. Oh my gosh, that's amazing. Yeah.
It's amazing.
How have we not heard? Well, maybe some of the people watching have, but how have I not heard that? That's fantastic.
It's an inspiring story because, that boat lift, the 9/11 boat lift, became the largest boat rescue in the history of the world, even larger than the Dunkirk rescue. And
that's
when
what
I think
was thinking of as you were telling the story.
That's right. And what it shows is it shows who we really are. And I think this is something that we have to remember, not just now, but well long after the pandemic is over, that when we are true to our nature, when we are generous, when we are kind, when we look out for each other, it not only feels good, but we actually do better collectively.
Yeah.
And we live in a culture that tells us that, again, it's about individual effort that determines individual success. We've got to look out for ourselves. It's a dog-eat-dog world. There are countless phrases like that describe the world as we think it might be. But I think that moments like this reveal the true character of a people. And we're seeing it, in communities across the country. And the truth is we're going to need more of it because this isn't over. And it's going to be tough for a while. We're going to need to lean on each other. And as much as we need the right policies in government and we need our organizations and companies to do the right thing, we've also got to look out for each other. That means calling people to check on them, to make sure they're doing okay. It means giving them the gift of your full attention. It means doing small things to help them out, whether it is virtual babysitting or whether it's dropping off food to them or whether it's simply letting them know that you're there for them. You know, as human beings, we all want to be seen for who we are. We all want to matter. We all want to be loved. And the truth is, those basic needs can be fulfilled by the other people in our life. We don't need money or fame or power to be able to do that. That's how extraordinary our power is, to be able to bring fulfillment and happiness into other people's lives. And that's why it is through our relationships, I believe, that we experience the greatest joys in life. And that's why I think it's at the core of what we need to refocus on if we want to build a healthier, more resilient world.
Oh, I absolutely agree. You know, I think we've talked many times, you know, obviously through my campaign about the leadership that we have been craving during this pandemic. But in addition to that call for service, you know, where we're asking people to do just that, because sometimes people just need to be asked, and they need to be, you know, I think, as you know, with little kids, you always ask them what they want to be when they grow up. And I think as we get older, it's not so much what our career is, but what is our purpose? And people want to feel that sense of purpose. And so much of that comes from service and from being able to help others. And we want to be able to, it's hard sometimes if that hasn't been modeled for you, to know what that should look like and how you can do it in small ways. And you know, I grew up in a house where my mom always invited somebody over for dinner. Our neighbor always came for dinner, and where she makes birthday cakes still now for the whole family, but we're not allowed to eat the whole thing because she's going to take a slice to 4 or 5 of her neighbors, just one slice. She's going to give them each some, so we better not finish it. But those are little things that are modeled all the time. And, you know, my dad, same type of thing, where he has his college friend, you know, that he always drives that person's mom to her doctor's appointments. So it was somebody, you know, Bill Nestor, his mom, he wasn't around. He lived up in Vermont, so who could drive his mom to doctor's appointments? It was my dad. And you see that modeled, but if you don't, it's hard always to know where you should insert yourself to be that service. And we need to see it. We need to think creatively about it. You have those kinds of friends that know just how to pitch in and be helpful. And how can we do that all now? And what are some examples? And I think you really have inspired us here tonight. And I hope that you're back in a position of leadership in our country, because you really have such a gift that you've shared with us here, but also with our country through your leadership as Surgeon General. And I look forward to reading your book. I think the title Together is just perfect for right now, and that message of inclusion that you've made so clear. And I want to thank you for joining us tonight, and I look forward to connecting with you soon. I hope everybody else remembers to get theirs, and that you stay healthy.
Thank you so much, Amy. It was so wonderful to be with you. And thank you in particular for all the focus that you're bringing to children and the need for social emotional learning. That's so important for our children to be able to build healthy relationships going forward. So thank you for all your service as well.
Thank you. All right, everyone. Have a great night.
Take care, everyone. Stay safe and well.